All right, everybody, welcome to another episode here on the Digital Trade Show podcast. We are live at the Profitable Dentist Practice Owners Conference in Orlando, Florida, and so excited to have with me this morning Missy White from NextLevel Practice. Good morning.
Good morning.
Thank you so much for coming on, and I'm excited to learn all kinds of stuff about NextLevel Practice. And I have to say that I was able to watch a little bit of the feed yesterday and got a little bit of a taste of the guy that you guys work with, Gary Cady. So it was really, really cool and stuff like that. But would love to learn more about you and your story and how you got to NextLevel Practice.
Yeah, so I was practicing clinical dentistry for 29 years. Worked as a dental assistant to start, and then I went into dental hygiene over the next number of years. And basically, at the end of my career, I started noticing that I just had a bigger purpose and vision for what I wanted to do and what I wanted to accomplish. I call it the fourth quarter. Gary talked about the fourth quarter yesterday. Right. But for me, my fourth quarter is a passion, and I have a passion to improve the lives of others, and that aligns with NextLevel Practice. That's their vision for getting people healthy.
Yeah.
And I just want to help encourage and inspire others to be healthy in mind, body, and soul. And that's what drives me in my passion.
Yeah. I have to say, Missy, it was one of the coolest things yesterday as I'm learning more about what you guys do, and certainly any company that works with practices, there's always that production focus. But one of the things that I noticed, whether it was information I looked at online or what you guys talk about, is the need to help the practices get the dentistry done. Because if that gets done, as you know, the rest of it takes care of itself.
Oh, absolutely.
I just love that that's one of the missions.
Yeah.
Yeah,
and our company, our biggest vision is we want to get 30 million people healthier by 2020.
I love it.
And our vision is to improve the lives of others. And that's what drives Gary. And we laugh because we always say that Gary, he has Red Bull flowing through his veins because he has so much excitement and he's so contagious. And we love that because his high energy drives us to create new things and looking at new technology. And we're really striving to meet the needs of the dentist and see them get healthier. And so we have a triple win philosophy, and that's that the dentist wins, the team wins, and the patients win.
Absolutely.
And so we have a triple win.
Yeah. Well, and I have to say, I always admire those individuals like yourself that practice for many years and could have kept doing that, certainly, and made a lot of progress and a lot of done a lot of great work. But the decision for you to want to, like you said, give back and go to this next level, which, actually, no pun intended there.
Yes.
That fits well. But talk a little bit about how it has been for you with all of your experience to now kind of be on the other side and, working with the practices and how you see a practice different from when you were actually actively practicing.
Oh, absolutely. The things that I've learned after coming to work for NextLevel has been amazing. I tell people all the time, I wish I would have known back then what I know now.
Sure.
It made a huge difference in my career and how I practiced dentistry throughout the years. I laugh because, we have different personalities, and, in our methodology, we teach about 4 different personalities. We have like the competitive personality, the methodical, the spontaneous, and the humanist. And these are all different personalities. And I found that for me, I was a methodical. And one of the things that I noticed most was I was actually, I call it vomiting on people, all these details. Right. And some people don't need all the details. They just need the broad picture. Or maybe they're a humanist and they're just concerned about getting themselves or their family healthy and being there. And so for me, I realized myself, even coming into NextLevel, learning the methodology, that things that I had done in my career that, really kind of hindered the case acceptance and hindered the growth of the patient, and maybe them kind of backing away from treatment rather than proceeding with treatment.
Sure.
And for me, just seeing the transformation of the dentist. We have practices come into us and, they're just frustrated. They're going to work every day. They hate coming to work, just upset about things and just ready to throw in the towel and hang up their loops because they just don't want to deal with everyday things.
Right.
And what I see is when the dentists come through our program and they go into our 1-year program, that at the end of that time frame, the transformation that's happened is incredible. And, we get dentists who are actually coming to work and glad they're coming to work. And the team is aligned and they have a common purpose. we're real big on building the team and getting the team to willingly accept the changes that we would like to have and not force.
Right.
And that's key to getting the team on board because, you know, if you come in and you're forcing things, your team's not going to be aligned.
Absolutely.
And so we do that by doing education, and we apply training by position and by role. And then we have measures and monitors in place that keeps them accountable to that. And then we call it giving them Scooby snacks, but the team gets Scooby snacks whenever they reach certain goals at the end of the month. And so we have bonus systems in place that reward the team. And secondary, we found that the team likes to have a bigger sense and purpose than just coming to work and collecting a paycheck.
Right.
And one of the things that we establish is community service with our clients. And so we have community initiatives, and when the team begins to feel a part of a bigger picture, it makes a huge difference about why they're coming to work. It recontextualizes their role.
Absolutely.
So
yeah, and then that's marketing, and they don't even really know they're marketing their practice.
Exactly.
They're doing great things in the community, and certainly more people know about them and things like that. Yeah, I thought it was interesting yesterday, the Scooby snacks and the correlation that Gary made with Michael Kors, and which I thought was hilarious, and the Coach purse and all that stuff. There's going to be, my wife's probably going to be like, can I have some Scooby snacks? I know where that's coming. So you guys have a lot of experience in working with practices, and certainly so many of them have worked with you. Can you talk a little bit about why a dental practice does not decide to work with a coach or a consultant? I mean, from your experience, I know a lot of times, I love the fact that you brought up, you had those blind spots as a provider, right? Because until you're on the other side, it's very difficult to see that having somebody else come in, it can be really helpful. What have you guys learned in regards to, I guess, helping somebody just take that last step to recognize that, okay, I am going to decide to bring somebody in and to have a coach or a mentor or a company like Next Level Practice help out? Talk a little bit about that. Why people, what stops them from maybe moving forward to work?
Yeah, the majority of the time what we see is fear of change and getting over that fear. I think the biggest reason that I hear a lot is I just don't know if my team is going to be on board with this. I don't know if my team will accept the changes that I want to make, and so they fear that they may lose employees, or and even sometimes it's personal change. Some doctors they've been doing things the way that they've been doing it, and they think, well, it won't work here, because and it's that philosophy. And sometimes they build something, we call it ants and filters, but ants stands for automatic negative thoughts, and filters is like where we might have a certain preset condition in our mind about how things are going to happen, or because of previous experiences, we're bringing that into today's time. Right. So that fear of the unknown, fear of wanting to know if the team is there. So what we do is we just assure them, and one of the examples that Gary gives, and Gary's really open about sharing his personal life, is he was an alcoholic, and he didn't know how to stop being alcoholic by himself. Sure. And many dentists are in that situation, not that they're alcoholics, but that their practices are running in a way that's not healthy, and they don't know how to get to the next level and how to get beyond that. So what we always say is, Gary said, I found someone who was sober for like 26 years, and I went to that person because they've already done it and been through it. Right. And he said, and I just said, how did you get here? How did you get to do what you do? And how did you overcome it? And he says, and because he had already been there and done those steps, he already knew the path and the way. Sure. He says, and all I had to do was step in and follow it. Yeah. And so that's what we talk to the dentist about, is we as a practice and a business management firm have already been there. We already know the road to success. And if it's just the dentist being willing to overcome the fear and step into that and just follow what we've created, it's all systematic, it's all automatic. And so just overcoming that. And like I said, we always get the team to willingly embrace. One thing that I've really been excited about is recontextualizing the team, and you may have heard Gary speak yesterday a little bit about this, but we call our front office, they're not front desk anymore, they're called DOFIs, and it's Director of First Impression, and this is all about the employees stepping into a new vision and purpose for why they're coming to work every day, and that's one example. The other examples, we have our ninjas, and it's, no, I'm not just an assistant.
I love it.
And then our hygienists are hygienists. And then we have our insurance coordinators are now our financial freedom fighters, and they come to work in a different way, knowing that they're fighting for people's health and fighting to get them worked into their lifestyle, the dental treatment that needs to be done. And and our appointment coordinators, are with the DOFIs, and like I said, they direct first impressions. And so we're excited about that, and our spouses are VIPs, and our dentists become complete health practitioners.
Sure.
They're not just a dentist, and that's what we get them to recontextualize who they are as well. So
it's interesting reframing something as simple as that. I would imagine when you probably go in with the teams and you give them those new names, just to probably watch them prop up a little bit to kind of put their chest out and feel proud of who they are. When you guys bring that to light, which I think is really cool.
Absolutely. And when they love coming to work today, that's when you get stability in your practice and you reduce turnover, because they're coming as part of a community. They're coming together, recontextualize with their role. For me, I had a huge shift even after I practiced hygiene. For many years, I was just a hygienist before. And then the last few years that I practiced, I become a complete healthcare advocate.
Sure.
And that changed who I was. And, I looked at things before, the little things that I was doing during the day, like my periodontal probings and my exams and my blood pressure and things like that. I was looking at it like a task, like another thing I had to check off my list. And, we laugh, but it's like you go to a hygienist and you tell them, I'm going to add one more thing to your schedule in that hour, and they're going to taser us. They're going to get upset and mad at us for that. And but when you recontextualize your role, those things stopped being a task and they started becoming a tool. And when you know that you're getting someone healthy and you see that they're not going to have inflammation in their mouth anymore, and their blood pressures are getting better and their diabetes is getting better, and when you see that, it takes a whole different level, of what you're perceiving, what you're doing, and it's much more satisfying, as a practitioner to have that.
Dentistry is finally, after all these years, obviously all this great work with the oral systemic link and people realizing that holistic approach. And it's so exciting to see. And I think it's kind of interesting, the correlation between, businesses like you guys helping people reframe who they are with what's going on in the industry. I mean, there's a lot of science finally out there where the dots are connecting, that people are realizing the impact of the dental team being taking more of a holistic approach towards patients' health. So.
Well, and if I can give you some facts, can I give you a few facts?
Love facts.
We have a system where we track over 6 million patients with our clients, and so I'd like to pose a question to you, just see if you can guess what that number is. And you can't, if you listened to it yesterday, you can't say from that out. But so what we found is that out of 6 million patients, what percentage of those patients do you think are diagnosed or offered treatment for periodontal disease?
I did hear it, but we'll talk about it. But maybe I might have not been listening completely. Was it 8%?
8%.
Okay.
So 8% out of 6 million people are being diagnosed and offered periodontal treatment in the practice. And out of that 8%, what do you think the percentage is of people who are actually getting the treatment and accepting the case for that?
3.
Close, 4. So about half. So you can see that right in the practice, some people feel like that the way to growth in the dental practice is through acquisition of new patients. And that is one way, but we have a system called CARE, and it's CARE. The CA stands for case acceptance, which is, existing patients in your practice. R is the retention, and that's a retention of getting patients to come 2 times a year for their regular cleanings, or if, some people a little more frequent, but an average of 2 times per year. And then the third is the acquisition of a new patient. So that's our CARE system. And what we find is that most people, or most practitioners, feel that the acquisition of the new patients is the way that they grow. And what we have found is when we look at their capacity of their practice, is that they're sitting on a gold mine many times just on case acceptance and retention. And so a lot of times we look right at that first to see where our gaps are and where our opportunities are, to increase their practice just from those 2 areas.
Absolutely.
We have national benchmarks that we have, and our national benchmarks is that we want 90% of the hygiene recare rescheduled, before they leave the practice. And so we look at those benchmarks compared to where they're at. And then we just offer training. We have automated training by position, and we can train those hygienists and the appointment coordinators so that they know how to talk to the patients. And the main thing that we see is we have to create value for the treatment that you're offering patients, because that is usually the gap. People say a lot that, well, only do what my insurance covers, or the patients won't agree to accept the case. And sometimes it's not always financial. It's just sometimes it's like they're not hurting, they're not in pain, so they don't understand the value behind that. And that's where the complete health comes into play, where we're explaining to patients, and our team members are learning how to explain to people that the mouth is a source of inflammation, and that's what we're talking about, that 4% being offered treatment, and accepting treatment. And how do we get that 4%, up to 100%, of treatment? And so it's all in patient education. And we have several tools to do that. One of the things I just wanted to show is we have a Say Ah documentary. And so this is something that the team can watch and learn about the oral systemic health. Gary produced this several years ago. And it's a great tool. Some dentists are even using this tool to go into their community and like rent out theaters, and they have like a community event. And this is also a great space for marketing for them, but also for the team. It's educating the team about why they're coming to work and how they teach the patient, on how to deliver complete health, and create value for that appointment and for the services that are offered. So, and then Gary also, just to mention too, Gary also wrote a book, $1 Million Dentistry, and if you'd like a free copy of that, you can actually text MOMONEY, MOMONEY, to 44222. You can get a free PDF copy of this, and that'll also give you the opportunity to get an email from us. If you have questions or things you want to speak to us about, we're happy to do that for you.
So that's MOMONEY. Yes. I just wanted to say it because it's fun, right? I mean, it's just, what's that great song in the 90s? Mo money, mo problems, that's right? So it's Mo Money, and then what's the number again to text? 44222. 44222. Excellent, to get that awesome book.
Yes.
Well, how else can people learn about Next Level Practice? Share real quickly how they can find all of you guys and spend some time with you, all that good stuff.
Yeah, so we have a website. If you'd like to go to our website, it's www.nextlevelpractice.com. You can go under resources and you can tab down. We have events that you can attend. We have over 35 events left this year. You can go in and you can search for that. You can also scroll around on the website. We have some testimonials there for some practitioners that are clients of ours now. And we also have some resources. One of the educational tools that we use for the hygienist is something called a healthy mouth baseline. So what we feel strongly about is in our healthy mouth baseline, you have to have a standard of care in your practice so that everyone is consistent. Sometimes you get 3 and 4 hygienists in the same practice, or maybe with several assistants, and even sometimes multiple dentists in one practice.
Absolutely.
And it's important to establish like what is a healthy mouth in your practice. And by having a healthy mouth baseline, that actually establishes health from unhealth, healthy tissue. And so it gives the opportunity that you sit down with every patient, every visit, and you present the healthy mouth baseline. And you can download that on our website as well and get a sample of that. And that's something that we really encourage because, again, that's part of the patient education.
Absolutely. And if I could just say something about that, I had the opportunity to sit in several years ago when I was working with the dental group that I worked with. And it was fascinating, Missy, where you would have 2 dentists in the same practice, and they would put up like a picture of the tooth and their determination of when it needed a crown or when it needed a filling, and to have the team there. Because a lot of times, as you know, the team gets confused. One provider may say, well, in this particular case, this is what I want to do. And it was amazing how sometimes their case, their determination of what they wanted to do was very different.
Right.
And so, I mean, I love that, establishing a baseline in the practice to give everybody a clear vision of how the patients are going to get healthy, because without that, I think it can get confusing.
Yeah, it absolutely can, because and Nick said sometimes you just get someone who's a little more conservative, and someone else is a little more preventative, and so there is that fine balance there. And one thing that we also discover is sometimes when there's a second practitioner or an associate in the practice, that you also can get kind of an associate cliff where you might have one very experienced dentist in the practice and one that's maybe a newer dentist, and so what happens sometimes is that the the younger, newer dentist that comes into the practice may not treat certain conditions. And what we find sometimes is if they don't treat them, they don't diagnose.
Sure.
And so by having that healthy mouth baseline in place, it kind of gives a standard of care across, across the playing field so that everybody is playing the same game. And you have that. And each practice can customize their own.
Sure.
If and also, here's the other thing that helps is with the healthy mouth baseline, a lot of dentists, we see this all the time. A patient will go down the road and they'll get a lot of treatment done. And they come back to the original dentist and get their teeth cleaned, and they're like, well, what did you go down the road for? And they say, well, I didn't know that you provided that service. And so what we do is with the Healthy Mouth Baseline, it opens up all the services right there on the page of what you offer and what you're treating. And that way the patient does know that you offer those services. And it's a way of making sure that you cover everything in that appointment.
I love that. So everybody, check out Next Level Practice, learn about all the great things they're doing, and if you haven't had the opportunity to watch yesterday's event where Gary was up there, it was awesome, and so many great nuggets, lots of energy, as you know. I was actually watching the stream. I think there was people saying, how do I work for that company? And Missy does, and certainly, she adds such a great component, as a practicing hygienist and bring all the experience that you've brought. So how about some fun questions real quick?
Sure, I'm up for it.
Okay, all right. I'm really curious about this one. So if there was a song that best described you and your career, what would it be?
Oh, gosh. I don't know about my career, maybe, but I guess I can say this. Yeah, my husband just wrote it the other day, and he said, "Brown Eyed Girl."
Oh, there you go.
That was my song. So
awesome.
From there,
awesome. That's a great one.
So.
How about your favorite sandwich?
Oh, gosh, a sandwich without bread. I don't do gluten, so I have to say a sandwich without bread. And then the next thing would be turkey.
Got it. Okay. How about a place that you have not been able to travel to yet that you cannot wait to go to?
Oh, okay, that's easy. Bora Bora.
Okay.
I have a dream that I want to go to Bora Bora, and I want to stay on one of the huts that's over the water with the little fish tank view on the bottom of the floor.
Yes, they look good, and the commercials always make them look way better.
Oh, I know. But that's a place that I really want to go, and I'm excited about that, and going to make it happen. So
awesome.
Here's something funny. We talk about personal things, but working for Gary is really awesome because in our company, in order to inspire us to come to work and recontextualize who we are, we look for bigger and better goals that we want to accomplish. Sure. And so we have to write out a 100 dreams list. And I don't know if you've ever done that before, but I encourage you, if you haven't, try it. And we do 100 dreams, and we put them on a list. And then we have, each year, we report on what we've accomplished and what we've done. Just to tell you a little quick example is last year, on my dream list, I had that I wanted to take a trip to Rome for my daughter. She was graduating, and I wanted to give her the option of where she wanted to go, and that was her choice. And so I just reversed engineered it. I figured out what it would cost, and I kind of went backwards and knew what I had to every month. And Gary helped me with that. He was great about helping me get things in order. And we took the trip last year.
That's
and we
awesome.
spent 7 days in Rome. And it's been wonderful.
Yeah.
And but that's one of my dream places.
So now you got 99 dreams left, right?
Yeah, 99. yeah. I have a few.
That's awesome. Well, real quick before we finish out. As a hygienist, if if given the opportunity to go speak with some of the newer hygienists that are getting ready to start in their practice, with what you've learned, not only in your own career, but even with Gary and Next Level, what would be one thing you would say to the hygienists out there now?
Yeah, for the hygienists that are out there now that are starting out, I just say, to look for opportunity to do something bigger than just, being a gum gardener.
Sure.
Do something else. Have a bigger vision, because I will tell them that, burnout can come really quick because it is repetitive. It's a repetitive type of job where, you come in, it's day to day. It's, you're scaling and you're polishing and you're teaching, and you often say the same things. And I think that you just have to establish for yourself a bigger vision, and just learning that you're, like I said, being a complete healthcare advocate makes a tremendous difference in how you come to work every day and the goals behind it. And, just encouraging them to reach out, get education, and educate their patients and know they're changing the world one patient at a time.
Absolutely.
And I think if they get that vision, it's really helpful to prevent, them burning out and being stressed out. And then just looking at the things that they're doing every day, not as tasks, but as, having a tool and being able to use that to keep people healthy.
I love it. Missy,
Yes.
thank you so much. This
You're
has been
welcome.
awesome. It's been great to have you on and talk about the great things that you've done and certainly what you guys are doing in Next Level Practice. So remember, Mo Money and
44222.
44222. So thanks so much. It's been
You're
been a
welcome.
pleasure and excited to see you guys get closer to that goal of getting patients healthy.
Thank you so much. And we're honored that we're here and that we're representing and just want to make a difference. And thank you for having us.
Awesome. All right, take care.
Take care.
Bye-bye.